Talk about pediatric concussions. A lot of times there's a misconception that you have to have a loss of conscious in order to have that. But a lot of times kids will fall out of swings, fall out of trees. They may have concussion. If you're not sure, go have them assessed either at the pediatrician or the emergency room and let them make sure, do their testing to see that. But unbeknownst to most healthcare professionals, the first thing to go and the last thing to come back with concussion, whether it be pediatric or others, is eye pointing and tracking. And we can do tests that can say, has their eye tracking recovered? Has it come back to normal accepted levels, which is kind of a gold standard nowadays with athletes or with young kids where they can start back being active again. So it's very important to give them a couple days to kind of just rest, relax, take it easy for a little bit as their brain's recovering. The good news with pediatric concussions, everything else, they're young, they're healthy, they recover faster. And then they don't have as many pathways that have gotten disrupted quite often. So usually they're not as disruptive on that. And just with time, they usually will be self-limiting. But if for some reason, if they have a severe brain injury or something that's more traumatic, that's where they may actually need a little therapy to kind of help get them back on track on the right pathway, and by creating these pathways in the brain with that. So pediatric concussions definitely can occur. And like I say, good news, usually they're self-limiting. You just don't want to get started back too soon. And you always want to have that assessed just to rule out, and if nothing else, just to know what's the status of with your child, what's going on. Do they have had a concussion, not had a concussion? Because that makes a difference on how you would proceed from there, and definitely get with your medical specialist who can then tell you what the next protocol, what's the best thing to do from there.